Good afternoon, everyone. I'm pleased to be here to discuss the significant strides our government is taking to ensure Albertans receive timely access to surgical care. I am joined today by Pete Guthrie, Minister of Infrastructure, Martin Long, Parliamentary Secretary for Rural Health, Sean Shilton, Interim Vice President of Clinical Operations and Chief Operating Officer for AHS, and Janie Klink, Senior Operating Officer at the Royal Alexandra Hospital, Lois Hole Hospital for Women, and Sturgeon Community Hospital. Albertans deserve access to healthcare services when and where they need them. We should not be seeing discrepancies in healthcare delivery or in the quality of care across the province, and every Albertan should be able to access surgical care within clinically recommended timelines. Our government is working to refocus the healthcare system to prioritize patients and improve the delivery of services in every corner of the province. Albertans deserve reliable healthcare, and a new integrated system will improve patient outcomes and better support our world-class healthcare professionals. But it will take time, and while we continue to engage with Albertans and advance our refocusing efforts, we need to take immediate steps to boost capacity, reduce wait times, and find efficiencies to address the existing surgical backlog. Through Budget 2024, we are investing $313 million over 3 years in the Alberta Surgical Initiative Capital Program. These funds will be used to renovate surgical suites and support areas in various communities across the province. We are also providing $305 million to Alberta Health Services to enable the completion of 310,000 surgical procedures this year. That's an increase of almost 6% from 2022-2023 year. The Alberta Surgical Initiative focus on improving every patient's surgical journey from the moment they seek initial advice to when they are referred to a specialist to their surgery and rehabilitation period. It recognizes the need to put patients first and to manage capacity, and to do whatever we can to ensure Albertans receive required surgeries within clinically recommended wait times. We are also providing $159 million over 3 years to renovate several medical device reprocessing departments, which is really the sterilization areas, to support surgical services and help address the surgical backlog. So these renovations will improve efficiency and sustainability, enabling more surgeries to be performed locally. Budget 2024 puts Albertans first. It recognizes the need to refocus our healthcare system while making investments to ensure Albertans have access to the care they need. It prioritizes patients while improving service delivery and empowering healthcare professionals. And it invests in surgical care because no one should have to wait for answers or for treatment longer than clinically recommended. The funding we are announcing today will make a real difference to patients across the province while we continue to build a better system that supports Albertans for generations to come. So thank you for being here, and I'd like to invite my colleague, Minister of Infrastructure, Pete Guthrie, to say a few words.
Well, good afternoon. I'm pleased to be here today along with Minister LaGrange. Thank you for those words, Minister. MLA Long, Mr. Chilton, and Ms. Klink to share this exciting news. Now, as you have just heard, Alberta's government is investing $313 million into the Alberta Surgical Initiative program to increase surgical capacity across the province. This investment will improve healthcare and its timely delivery for all Albertans. My ministry and Alberta Health Services share the responsibility for delivering these important projects throughout the province. AHS is the lead for design initiatives up to $5 million, and my ministry takes responsibility for those above this threshold. Alberta Infrastructure is now working on 20 projects in 11 different communities and not just in our major cities. Currently, development is underway for several of our rural communities, including Brooks, Port Saskatchewan, Innisfil, Olds, Ponoka, and Stettler. not to mention a couple that are nearing completion. In Lethbridge, 2 operating rooms are being upgraded and expanded, along with the addition of more inpatient space. When the project is finished later this year, the redevelopment will double the hospital's surgical capacity. And I'm also pleased to share that we are putting the final touches on an expansion and renovation in Rocky Mountain House that will add a brand new operating room and a medical device reprocessing department. Over the next few years, the 2024 capital plan allocates $159 million to renovate medical device reprocessing facilities throughout Alberta. This funding will benefit communities as far north as Fort McMurray and as far south as Drumheller. Expanding these existing facilities enables hospital to sterilize medical equipment and instruments for reuse, creating efficiencies while also reducing costs. These initiatives are not just an investment in our healthcare system. These projects support hundreds of jobs relating to planning, design, and construction. As Minister, I'm excited to be delivering on Alberta's heavy infrastructure agenda, and I look forward to what the future holds. So with that, I'd like to turn it over to MLA Martin Long, Parliamentary Secretary for Rural Health, to provide some more remarks.
Thank you, Minister Guthrie. The investments being made through Budget 2024 will result in more surgeries being completed across the province and will benefit rural communities like the one I'm proud to call home. Rural and especially remote Albertans are faced with geographic barriers, limited healthcare infrastructure, limited access to technology, and a lack of healthcare professionals, particularly specialized healthcare professionals like surgeons. The current surgical wait times exacerbate these already difficult circumstances and can lead to negative outcomes for patients and their families. These investments are critical, and they will make a difference. The funding being provided to the Alberta Surgical Initiative Capital Program will help to bridge existing gaps by renovating surgical suites and support areas, and by creating new spaces for patients to receive care. Included in the plan are renovations to facilities in rural communities that are home to hardworking Albertans who have waited far too long for these improvements. Budget 2024 also includes an investment of $159 million over 3 years for renovations to medical device reprocessing departments across the province, including in Westlock and Drumheller. More funding for surgeries, health infrastructure, and technology means more Albertans from all corners of the province will receive surgeries closer to home within clinically recommended wait times. That means more Albertans receiving the care they need when they need it. And that is something we can all be proud of and excited about. I'd like to thank the Minister of Health for ensuring the voices of rural and remote Albertans continue being heard, especially when it comes to their health and well-being. I'm proud to be part of a government that is focused on ensuring Albertans have a reliable, accessible, and equitable healthcare system. It is needed and it is deserved. I look forward to continuing to work with my colleagues and our partners to deliver a refocused healthcare system that will serve our province for generations to come. I'd now like to invite Sean Chilton to say a few words.
Thank you, Parliamentary Secretary Long, and thank you, Minister LaGrange, for inviting me here today. Timely access to surgeries is important to Albertans, and it's important to Alberta Health Services. Our partnership with Alberta Health on the Alberta Surgical Initiative, or ASI, is focused on ensuring Albertans receive their scheduled surgeries within their clinically recommended wait times. This collaborative is making a difference. More people are now waiting within clinically recommended wait times for their surgeries than did before the pandemic. As of March, we have 61.3% of cases at adult sites are waiting within clinically recommended wait times, and that compares to about 52.1% from a year ago. There are 4,400 fewer cases waiting outside clinically recommended wait times compared to the same time a year ago. We've also made significant improvements to the surgical wait list in 23-24 fiscal year, completing approximately 5% more surgeries compared to the previous year. We're now on track for approximately 305,000 surgeries in this fiscal, which includes more than 60,000 cases to date completed in chartered surgical facilities. The improvement's good, but we aren't done yet, and there's more to do. The ASI funding announced as part of Budget 2024 will allow us to further reduce wait times for Albertans and increase the number of patients accessing surgical care within clinically recommended wait times. We plan to increase the number of surgical procedures performed each year and invest in capital projects that will help us to do that, including new operating rooms and expanded medical device reprocessing spaces. My colleague Janie will speak to a few of those projects underway here in Edmonton shortly. We'll also continue to work on provincial referral pathways so that referring providers know what information, labs and diagnostics are required when making a specialist referral. This helps triage patients as quickly as possible. We're implementing the use of day surgery techniques to minimize the use of inpatient beds and to reduce lengths of stays. And we're also improving the efficiency and use of existing operating rooms, including building new infrastructure and optimizing existing OR space. We'll also be optimizing surgical activity at our rural sites and expanding the use of chartered surgical facilities, which are independent, accredited surgical facilities to support our increased surgical activity. Progress is happening, and I'm pleased to see the continued support from the government to help support this work. I'd now like to invite Janie Klink, Senior Operating Officer for the Royal Alexandra Hospital, the Lois Hole Hospital for Women and Sturgeon Community Hospital, to speak. Janie.
Thank you, Sean. Good afternoon. I'm pleased to be here today to share with you some of our work on reducing surgical wait times in the Edmonton zone and the benefit it's bringing to our patients and to our hospitals. Thanks to ongoing investments into ASI by the Alberta government, we are upgrading and adding operating rooms in our hospitals, which means increased access for patients and increased surgical volumes. New operating rooms have been added at the University of Alberta Hospital and the Lois Hole Hospital for Women. Planning is underway for additional operating rooms at the Mazankowski Alberta Heart Institute, the Sturgeon Community Hospital, and the Cross Cancer Institute. These new ORs will support general surgery, orthopedics, obstetrics and gynecology, urology, and cardiology. We are also investing in upgrades to the day surgery department at the Fort Saskatchewan Hospital, which will support procedures for gynecology and ophthalmology. And we're expanding, as you heard, our medical device reprocessing areas in many of our hospitals so that the teams can support the increased surgical volumes, the throughput, and the demand for sterile medical instrumentation. We are planning for renovations to MDRs at the Royal Alexandra Hospital, the Sturgeon Community Hospital, and the University of Alberta Hospital. These investments will allow our MDR teams to service more operating rooms, keep up with increases to surgical volumes, and provide the highest standard of practice when it comes to medical device reprocessing. Since ASI was introduced, it's allowed us to open new operating rooms, create and expand procedure rooms, upgrade and purchase medical equipment, which allows us to increase surgical activity and capacity in the Edmonton zone, hire additional and very necessary workforce to support the increase in surgical activity, and so much more. We've also invested in initiatives to support those that are waiting for surgeries. Rapid Access Clinic in Edmonton for orthopedic patients that are presenting with conditions, hip, knee, and shoulder conditions. The specialized clinic is going to offer a point of access for referring providers from primary care. It's going to allow for timely screening and assessments, referrals to orthopedic surgeons as required. And for those patients where surgeries are not indicated just yet, it will provide assessments and screening and options and treatment plans, which will include exercises, referrals, and education as patients are waiting or going through their non-surgical journeys. For patients, the initiatives underway and across the province as a result of ASI, great value add. Our partners in Covenant Health, who are part of our surgical programs, have also got site projects and initiatives underway supporting ASI and surgical care for patients in the Edmonton area. I'm very grateful for the ongoing work and support for ASI, and I look forward to working collaboratively with our healthcare partners and our ultimate goal of ensuring that Albertans are receiving their surgeries within clinically appropriate wait times and increasing access and care for all Albertans. Thank you.
All right, thanks, guys. With that, we will turn it over to questions. I'm not sure that you can hear me, but just a note, as I said previously, we do have until 1:10 to get the ministers up to question period. And we'll start with questions in the room, and just to keep things rolling timely, we'll stick to one question, one follow-up, go over to the phones, and then come back to the room for additional questions if we have time. So please raise your hand if you would like to ask a question, and with that, go ahead.
Sure, yeah, for the minister. I'm hearing from some doctors who say the workforce really has been decimated, that they haven't worked a shift in the last 3 months, or they haven't been short-staffed. Of this, I see the $305 million going towards these 310,000 surgeries this year. How confident are you that we actually have the staff to be able to perform those surgeries, and if not, what's being done to recruit them?
Well, we're already at, as Sean indicated, 305,000 for this year. This would be adding an additional 5,000 on top of that. My understanding is that we do have the staff in place. Obviously, there are certain aspects of staffing of the workforce that are more challenging than others, particularly, particularly around anesthesia. And so AHS has been working diligently to recruit more anesthesiologists across the province, and there's additional work being done in that area. Sean, I'm not sure if you'd like to add anything to this conversation.
Thanks, Minister. I'd just say that, workforce is always something that we're concerned about, and but we continue to work hard at recruitment and retention. It's important that we keep the people that we have, as well as recruit new people. So major focus of ours is on Canadian and international recruitment, and some focused efforts to see if we can actually ensure that we have the right workforce in place to support the work. We're starting to see some gains, but there's still some work to be done.
Yeah, and just as a follow-up, looking closer at the budget, it looks like 45 million of the 313 will be spent this year. So I know there was some information provided by Ms. Klink in regards to what's been done, I think, in previous years, but just looking for some clarification of that 45 million for this year, where will that go in Edmonton?
I'll turn that back over to Janie, if you have those numbers. Otherwise, we can get the detailed breakdown for where it's going in Edmonton.
Yeah, I think
Thank you.
Yeah, thanks, Minister LaGrange. I think, we can get the detailed numbers. I think we've got 18 projects actually planned for 2024 in the Edmonton zone alone, and that's just a portion of the projects in the province. Some of them have been continued, have been started and are continuing into this next fiscal year, and a lot of them actually are planned and new, but I think it's 18. We can get you the numbers.
And Minister.
Yes, so there's infrastructure-led, and then there is those that are led by AHS. In Edmonton, Grey Nuns, Misericordia, Royal Alec, Walter Mackenzie, and U of A are projects that are being done through infrastructure. And then through AHS, Royal Alec has a couple of them going. The Lois Hole that we've already discussed. Yeah, Royal Alec has another, Cross Cancer, and Mazankowski, as well as U of A.
Jonathan, go ahead.
Jonathan Bradley, Western Standard. So you said that there's going to be you've committed to performing 310,000 surgical procedures this year. What type of surgeries do you anticipate most of those being?
Well, they've run the full gamut of surgeries, from minor to more complex surgeries. What we are seeing is that we're able to utilize the chartered surgical facilities. They're doing approximately 60,000 surgeries a year. They alleviate the stress on our hospitals so that they can do the more complex surgeries. So it's everything. But again, we're wanting to make sure that they're done within clinically approved timelines. And going from pre-pandemic, I believe we were at about 40% within clinically approved timelines. Now we're over 60%. We want to see that number go even higher. I'd love to see 100%.
Okay, and with that being said, you said many of the surgeries will be taking place at chartered surgical facilities. Where do you stand?
Well, chartered surgical facilities are doing approximately 60,000. The remainder of that 305,000 that currently are being done this year are at all of our hospitals across the province. And again, we want to utilize those smaller hospital settings, and that's why we are investing in capital infrastructure right across the whole province.
Well, I was going to ask, where do you stand on expanding the chartered surgical facilities further?
Well, they have a place very much, if you think of a chartered surgical facility very much like a doctor's clinic, they put up their own capital, they build their own facility, and then we pay them for the work that they do. And it's all publicly funded work that they do. There is a place for them because, again, they allow for that expansion of capacity across the province. So they have a role to play. And as I indicated earlier, they do alleviate the stress on our hospitals so that they can do those more complex surgeries where you need, more complex teams around to support the physician, the surgeon.
Thank you.
Yeah, looking at the surgical wait time dashboard, it looks like in the past few years, the wait times have been in that 40 to 60% range for out of scope for the last few years. When do you hope to see that, as you say, 100% or 90%? When do you actually hope to see some real movement?
Well, as soon as possible. We're certainly striving. We're taking that multi-pronged approach by everything that you've heard here today. But again, I have said this before, I'd rather under-promise and over-deliver. I don't want to put a timeline on it. We will work to get everyone to that 100% within clinically approved timelines. But right now we still have backlogs to deal with, and I can't anticipate what other issues may come up as we go.
And I'm wondering, for these clinics, do we have any data on how often patients are then referred to acute care centers for complications such as infections?
Well, all of those would be tracked. I'm not aware of any huge numbers. I'm not sure if you have any of those.
Yeah, I wouldn't have the data available, but it is something that we track as part of our agreement with those chartered facilities, is to look at complications.
All right, excellent. Operator, is there anyone on the line?
No questions in queue at this time.
Perfect. Okay, so we'll do one more pass through the room if anyone has any additional questions to ask. All right, perfect. Then we will wrap. Thanks, guys.
Thank you. Thanks, everyone.